I am Dr. Tavya Benjamin. I am from Northwell Health, particularly Glen Cove Hospital in New York. Risk stratification helps us identify which patients are at highest risk for progression of their disease, and it helps us figure out where they should fall in terms of the treatment algorithm. Prostate cancer risk category is dependent on a multitude of things. Patient's age, Gleason grade or the aggressiveness of their cancer, the extent of the tumor, whether it's localized or it has spread to different areas, as well as laboratory values like their PSA levels, all are taken into account to determine their risk stratification. So your Gleason score is a measure of aggressiveness of cancer and how abnormal the cells look under a microscope compared to normal cells. And that is taken into account into which risk stratification you fall on. The more aggressive, the more abnormal the cells is the more aggressive or higher risk stratification that you fall into. PSA is a general marker of prostate health, but it's very non-specific. And the amount that it is elevated really helps us determine, how aggressive or how much of an issue we potentially are dealing with. PSA can be elevated because of infection, from trauma, just because you have an enlarged prostate. So determining the degree of elevation in conjunction with prostate size is really important in determining overall risk. Your clinical stage has to do with the overall extent of your cancer, whether it's limited to the prostate, is it in just one area, is it close to the edge, has it started to spread outside the prostate, is it just in that region in the pelvis, has it spread up to other organs? And so all of those things are taken into account to figure out how aggressive and what treatment options are best for you. So the tumor characteristics in terms of size and location are taken into account in when you're determining someone's risk. You want to make sure that the cancer is completely treated in whatever treatment modality you approach, whether it's radiation or focal therapy or taking the whole prostate out with a radical prostatectomy. So taking into account the extent of the tumor, the size, does it cross midline, is it near the urethra? All of those things are very important in determining what's the best treatment strategy. Risk stratification is very important to determine how we offer treatment options for patients. If for localized disease and low risk, patients really have almost all options at their disposal. As you become a higher risk patient, based on your laboratory values, your PSA, your biopsy, your MRI characteristics, the treatment modalities that are offered are really honed into what's going to offer you the best curative option so that we can treat you with the intent of curing your cancer. Your risk stratification really does not mean that you are going to die of your disease. If you have a high risk stratification, it does not mean that you are more likely to die. It really just helps us frame how to best treat you so that we can give you longevity of life and optimal quality of life. Your risk category is going to be reevaluated in numerous intervals throughout your treatment modality. PSAs are going to be rechecked. Imaging often is rechecked. Looking at the local extent of the disease. All of those things are taken into account. It's a dynamic process that continues throughout your treatment. There are a whole host of different types of tests and molecular biomarkers that can be used to help better risk stratify, whether it's a blood test or a urine test, or actually doing further genetic testing on your biopsy material. All of those things can be taken into account and used to help better risk stratify and better counsel patients like you on how best to treat your cancer. Your risk stratification takes into account you as a whole person. PSA screening and treating a prostate cancer should be tailored to you based on your values, your preferences, as well as your overall health status.